Ricket, sorry, Rickettsial disease, Q fever, and Chlamydiosis. Ricket, sorry, Rickettsial disease, Q fever, and Chlamydiosis. Most covered emerging and re-emerging disease and are being increasingly recognized in India. Vladimir Lenin, Russian Revolution. Either socialism will defeat the lodge or the lodge will defeat the socialism. Napoleon is retreated from Moscow. Rickettsial disease among his soldiers infected with ice. Epidemiology. Clinical case reported across India. Take a side between bacteria and virus, having no flagella, obligatory intracellular, transmitted by arthropod vector. Character bacteria Rickettsia virus. Genetic material possess both DNA or RNA. Division, binary fission, replication. Stability, instant reaction, no instant reaction. Nature, non fastidious except some fastidious. Cellular activity, intracellular. Global ability, bacteria can grow in artificial medium, require living cell or embryonated egg for growth, Etiology, Rickettsiaceae, Anaplasmatiaceae. Orientia, Rickettsial, Scrap typhus. Group agent disease vectors reservoir. Spotted fever group Rickettsial, Rocky Mountain spotted fever, RMSF, tick, dermatocentor species, dog rodent. Rickettsia acari, Rickettsial pox, mite, Allodermensus sanguineus, mice. Rickettsia conuri, Indian tick typhus, Bottonius fever, Mediterranean spotted fever, MSF, ticks, dog and rodent. Typhus group Rickettsial Provajeski, epidemic loss born typhus, Brilginser disease, lice, human, Rickettsia typhi, murine flea borne typhus, philia, Genopsilas rat, scrub typhus, Orangia, Shushugamisi, scrub typhus, cigar, rodents. Rocky Mountain spotted fever, Rickettsial, Dermatocenter variabilis, American dog ticks, Dermatocenter Andersoni, Rocky Mountain wood ticks. Race in a common sign in people who are affected by RMSF. Scrap typhus or bush typhus. Thousands of cases in the Far East during Second World War among the soldiers. The word scrub is used because of the type of vegetation terrain between wood and clearing, which help to ensure the vector, and the term typhus. It derived from the Greek word typhos, which means fever, with stupor or smoke cognate with the Sanskrit word of smoke, dupa. Japanese word shushuga means dangerous and mushi means insect or mite. Itchler with the typical center black scab like a cigarette burn on the skin. Diagnosis. Diagnosis. Isolation of the organism. Isolation should be done in biosafety level 3 laboratory. Rickettsia may be isolated in male guinea pig or mice, yolk sac of chick, embryo or vero cell line or MRC5 cell line from patient in initial stage of the disease. Serological test. Microimmunofluorescence, immunoperoxidase assay, latex, agglutination, indirect hemagglutination, enzyme-linked immunosorbate, blood immunoassay, and well-Felix test. Well-Felix test. The basis of the test is the presence of antigenic cross-reactivity between Rickettsial species and certain serotype of non-motile Proteus species, which was first published by Edmund Will and Arthur Felix in 1916. It demonstrated agglutinin to Proteus vulgaris strain OX19, OX2, and Proteus mirabilis OX-K. Cross-reactivity, the ability of an individual antibody combining site to react with more than one antigenic determinant. The ability of population of antibody molecule to react with more than one antigen. Immunofluorescence assay IFA. This is the considered as gold standard serological method for diagnosis of rickettsial disease. Therefore, it is suggest only for research and in area where prevalence of rickettsial disease is well known. Molecular diagnosis PCR. It can be used to detect rickettsial DNA in whole blood and HR sample. The result comes best within 5 weeks for blood sample become a presence of Rickettsiemia, Susugamisi, Rickettsii, typhi and Provajeski in first 7 to 10 days. Q fever, Curie fever, epitoyer fever, 9-mile fever, coccidiosis, Burnet rickettsioses. Except New Zealand, notable zoonosis, occupational or foodborne, highly mortality 1 to 11% in chronic cases, endemic in many countries. Most significant public health problem of uterine infection, high morbidity and mortality in pregnancy, abortion, unpredictable infection, sporadic and unexpected outbreak. It was first defined in 1935 in Queensland, Australia during an outbreak of febrile illness of unknown origin, Curie fever among abattoir workers. Q fever is an occupational disease in persons who are working with animals such as slaughterhouse worker, veterinarian and farmer, although infection is not restricted to this group. Urban outbreaks occur and cases with unknown sources or close contact with livestock have been reported as non-occupational exposure. Most range domestic animal, wild animal, cat, dog, cattle, sheep, goat, horse, poultry, arthropod, bird, rodent, primate, reservoir, extensively but only partially known, man reservoir, cattle, sheep, goat, bird, arthropods, pet, cat, rabbit, dog. Australian Q fever life cycle, Haemophysalis humerosa plus other potential vector. Source and transmission. Man, inhalation of aerosol, tissue, DuPont, infected animal birth, fluid placenta, fetal membrane, urine and feces, injection of contaminated milk and milk product, sexual transmission, ticks. Animal, domestic animal, natural foci, wild animal and tick. Inhalation aerosol from contaminated placental, amniotic fluid and etc. Semen, AI. The disease, man, flu-like illness, IP 1 to 3 week, acute fever, acute inacute phase, fever, chill, profuse sweating, retroorbital pain, frontal headache, unproductive cough, cheek pain, meningoencephalitis, hepatitis, splenomegaly, chronic endocarditis, osteomyelitis, abortion, animal asymptomatic, acute fever, loss of appetite, mild cough, rhinitis, rapid respiratory rate, chronic infertility, abortion, last trimester, returned placenta, birth of full-term dead or weak and lower weight offspring. Serological diagnosis, agglutination test, capillary agglutination test (CAT). Advantage: widely used sample economical rapid field test may be employed or undulant sera, uncommon non-specific reaction, high degree of reproducibility, higher sensitivity than CFT. Anti-complementary sera may be tested, useful for epidemiological study. Chlamydial zoonosis. Chlamydial zoonosis. Fundamental difference between chlamydia and rickettsia. Cytochrome positive, no cytochrome, aerobic metabolism, anaerobic metabolism, multiply by binary a single development cycle. In 1893 in Paris, flu-like disease is transmitted from parrot to man. Nogard isolated Salmonella psittacosis as causal agent of psittacosis. In 1929-30, first pandemic of psittacosis in human being occurred in USA and Europe by green Amazon parrot. 1932, first case of zoonotic psittacosis transmitted by chicken was reported. 1940, psittacosis was recorded in domestic pigeon. 1966, chlamydia was identified as bacteria, not viruses. Genus Chlamydia host, genus Chlamydiophila host. Microbiology. Obligatory intracellular bacteria. The organisms are non-motile, spherical, gram-negative, and have a cell wall. Chlamydia is a energy parasite. Chlamydophila species. Principal host, clinical sign and disease. Chlamydophila psittaci, bird, ornithorhynchus, pneumonia, conjunctivitis, pericarditis. Abortus, sheep, goat, cattle. Abortion, stillbirth, epididymitis. Felis, cat, conjunctivitis, pneumonia, chronic salpingitis. Cavies, guinea pig, conjunctivitis, genital tract infection. Pneumonia, human, cola, horse, respiratory disorder. Picorum, ruminant, swine, cola, intestinal infection, conjunctivitis, urinary tract infection, encephalomyelitis, arthritis. Mode of transmission. Inhalation, direct infective dropping, secretion or dust from feather, direct contact, handling of plumage and tissue of infected bird, improper disposal of infected carcass, aborted fetus or placenta, transovarian transmission in bird, improper cleaning of utensil, equipment, bedding of cattle and sheep farm, contaminated water and feeds. Microscopic examination, cultural technique, histopathological finding, test for antibody detection, direct complement fixation, CF test, elementary body agglutination EBA, agar gel precipitation test, test for antigen detection, immunofluorescent staining test, enzyme link immunosorbate acid ELISA, polymerase chain reaction. Thank you.